So step 3 in our process is the treatment. So the treatment is a part of the process where, again, you're going to be wanting to explain to your patient exactly what you're doing and why you're doing it. And this is where they might have some of the expectations that they have from previous sessions with other health practitioners, like if they've seen a chiropractor who's cracked them, they don't really know what they're expecting. So when I do the treatment, I'm generally wanting to focus on the main asterisk sign that I've found and how to correct it. So the best way to treat is to apply an intervention. So for the lower back, I do a technique where I try and get some movement between the joints, like a mobilization technique, and I apply it for a couple of minutes. And then I'm going to immediately retest the person to see if that has helped one of their main asterisk signs. And this is interesting because if again, we'll use the example of John with the bad back. If I do a mobilization on John's back and I get him up, a couple of things can happen. So if he was restricted to bend and then I've mobilized his back, if he can bend further, sometimes it actually hurts more to bend further. And this is a really important point. A lot of the times, young physios, you'll get John to bend and you say, oh, does it feel better? And it probably doesn't. But the interesting point is, what if he can move further? So there's been an improvement in his actual range of movement with bending. And what we have to say to John is, okay, well, doing that technique, it's opened up the joint and you're obviously bending a bit further, but it hurts to bend because you haven't bent that far in a few days. So when I do the treatment, I'm doing 1 or 2 very simple treatment techniques, and then I'm reviewing the asterisk signs immediately after. So with the physical assessment leading into our treatment, the physical assessment's obviously guiding us for how we treat, but I think the problem that I'm trying to help you solve is, I don't want you to feel like you've got to go and apply like 10 different treatment techniques and just give your patient a high volume of treatment. What we've got to do is we've got to be specific and we've got to give them quality. Now, the quality of the treatment is based on the quality of the physical assessment and the quality of your diagnosis. So if you feel like you've got a good diagnosis, you're applying your 1 or 2 interventions. You do those interventions, you see if they've got a result. If they haven't got a result, you can try a different intervention. You've got to have a lot of tools in your belt. So once you've found a treatment that works, you articulate that to the patient. Okay, well, that worked quite well. And then what you're trying to do is, from there, you're trying to give a recommendation. So again, my transition after the treatment to the recommendation is, okay, well, the next thing I'm going to do is, we've done the treatment and we've found that that technique's worked pretty well with you, and I'm going to try and give you something to do yourself that might be able to achieve the same result and help you get better in between the consultations.